provide
And
information that
this is our actual lab.
Our scientists have been working in the field of genomics and
VP of sales,
for the past 20 years.
the
They
lab.
provide
That's next generation sequencing. That's how we process the information. Most of the companies out there don't use that, and it allows us to get some really important data that we're going to be publishing.
This, we believe, is a series of tests that change the practice of medicine for the better, that provide useful and critical information previously unavailable to the urologist
and this is just for urology. We can do the same for pain, psych, and cardiac, and general medicine.
In prescribing drugs and avoiding adverse drug events.
Our tests
So
provide
that's the actual buccal swab coming into the lab. They snap it off, they put it in a little vial, they mark it, and then and when it goes to the lab, that's the report that comes out.
Metabolizers, intermediate metabolizers, extensive or normal metabolizers, as well as ultra-rapid metabolizers. The physician can use this information to establish the correct dose or alternate therapy based on the genetics.
We've identified 4 main areas that urologists can benefit from the use of pharmacogenomic testing, and that is first for patients on drugs for BPH. Secondly, is those patients taking erectile dysfunction drugs. Thirdly, is pain management. We think that's a vitally important area, both for relatively minor drugs as well as for the major classes of potentially abusive painkillers. The genes looked at in these panels that are offered specifically address about 80%
So it's pretty cool. We genetically mark 30 patients, and then they throw all their data into the new sequencers, and it spins around, and we sequence each gene, each person, over 200 times. So the specificity on what we do is just through the roof.
How do they know which gene they're looking at?
One of the major enzymes which metabolize drugs are responsible for about 25% of all drug metabolism and about 75% of deactivation of drugs in a person's system. These drugs can both be induced as well as inhibited by other drugs.
The problem with drug-drug interactions is the fact that if 2 drugs are using the same pathway of metabolism, then one of those drugs can actually block the metabolism of the others. With this very simple mouth swab test, we can determine if in fact the 2 drugs that are being taken are in a patient who has proper metabolism to handle those drugs. So rapid metabolizer, that would work. But if they're a slow metabolizer, it could be disastrous. We believe that this
So that's the next generation sequencing, where there's a chip where everything gets stored, all your genetic information gets stored with 29 other people on that chip, and it's stored in a major computer at AI Biotech.
Avoid adverse drug events and optimize the dosage of the drug as quickly as possible that's needed to improve quality of life as well as length of life. We think this provides a benefit in those settings. We are committed to bringing the latest and the best technology to practice to change the lives of our patients for the better.
And that other video, so it was pretty good. That one about the cardiology. You got that one too?
Cardiology video?
Yeah.
There's a pain one. If you have pain doctors, this is a podcast on, it's 13 minutes long by Dr. Trescott, so if you have any pain physicians, you can just forward this link to your pain doctor and let them.
It was that one, but you don't have to.
Oh, okay, yeah, okay.
It was just interesting.
Yeah, so this is basically, I've got presentations from Maryland and Stanford in here, and this is the one on Plavix that she's talking about, which is a cardiology drug that has an FDA genetic warning label on it that that's the low-hanging fruit for a cardiology sale. It's called an antiplatelet. And then anyway, we've got a presentation. This one here is the executive VP and I, just doing an intro to genetics and the basic information, but also it has all the information about AI biotech. And here's one on the individual genes and what they do. This is how to sell it, and I think when I record this, I'll probably just put this in place of that.
You're not
Hey.
recording now?
I know.
I'm asking.
No.
Okay.
There's a couple newsletters for the accountants and the billing people. There's a billing code that they can get to. Here's a article that was actually just published a couple weeks ago in CERC, and it talks about the importance of genetics. CERC is a leading paper for healthcare. It's like it'd be like putting in Time magazine.
Like JAMA, which is Journal of
Yeah,
American.
there's JAMA,
And Circulation.
CERC, and New England Journal of Medicine.
Isn't circulation more related to heart?
Yes.
Yeah.
And then we have other articles here. There's drug dosing guidelines. There's one that I had to relabel last night. How to perform a swab and fill out the form, which caused 12 emails to go
Did you
out.
get that, Craig?
Yeah.
Times?
Yeah,
Well,
I did. Yeah, I got it 12 times.
We're not sure where it came from.
Well, no, it came from the guy that designed the site, Artem. I said, look, when we post something, we'd like it to go out, and anyway, it goes out 12 times.
Craig, what's so funny about it?
I wonder what
is
that was.
That
Is it
one right
Tammy?
there, this one right here, how to perform a swab. Tammy has it, she sort of pirated it and put it on our own website, but it just says how to perform a swab. Didn't say anything about filling out the
Filling out
form.
form.
So I fell asleep after 4 minutes and didn't see that, so I said, well, how do you fill out the forms? And Ed looks at me, well, if you watch this video, then he goes to send it out, and it's coming like 12, 15 times.
Yeah, ironically, I didn't put the word "and" here.
But the swab is only 30
Don't
seconds.
mess with
The
it.
rest of it's all about filling
That's
out
on
the
the typo,
form.
but I
Yeah.
decided not to
Yeah.
rub it in.
So are these all, what's the main purpose of those links? Are they teasers that you
To
send?
educate you.
Okay, so it's just more
It's just-
internal education.
Yeah, it's just
of-
like links on a web page. Those are the ones you need to go to, one individually,
okay.
and that way you can look at them more than once to see the ones that, hey, this is really important. Let me. What about that the one that how to sell it? Is that the one you're gonna hone in on later?
Well, actually, when I
When
redo this,
No, I'm saying
He's gonna replace
today.
it. He's
Yeah.
gonna
When
replace
you're done, is that where you're gonna go?
yeah, I'm gonna what
Oh, do what we did yesterday.
yeah, I'm gonna
Okay.
replay yesterday and then just replace because the other one was not so great.
There's not a whole lot of very complicated thing. It's just kind of like getting everything stacked in the right sequence. It's very unlikely that you're going to run into a physician who knows this stuff real well because they never learned it.
Yeah.
So it's all after their continuing education is where they go. They're not interested in this. In when they go to Congress, there's meetings, conferences. They're not going to go see DNA, most likely. Now, they're going to go maybe a year from now, 2 years from now. All of a sudden, it's going to be very important to them because then it has elevated to the top. We're in the early stages
Yeah,
of
this is
this thing.
still the grassroots. It's only 1 and 2%.
So you go, it's going to be, you know what? What are you talking about? They know what DNA is, and they know that it's going to play a part somewhere. They know about the legal case with the breast DNA, BRCA.
1 and 2.
Yeah, and who owns that and so forth. So they know about that, but they don't know the detail that you'll have in your hands when you go in there. So, but again, it's more like this is what it is. This is what you do to the patient. This is what the process is, and that information you'll have, and then it's a question of whether they want to participate or not.
And this is an actual link to the FDA website that you can go down and you can see all the laundry list of drugs that have FDA genetic warning label lists associated with it. So this is not going away. If anything, it's going to be NIH is investing $60 million in genetic testing research right now, and there's just gonna be more stuff like this coming out down the line.
It's real important that you understand what this means, because basically 15 years ago, 20 years ago, cigarettes got the warning labels on, or maybe it was longer than that. This is the same thing. They didn't used to have any warnings on it. Only recently they've understood what kind of warnings they need to put in there. Enough lawsuits and the drug companies get smart, and then the government mandates that if there's a potential risk, you gotta label it.
The warning labels on the
On
prescription
the-
medications?
Mm-hmm.
Yeah.
It's actually on the box.
What about?
The box, well, that's right. When they dispense it, they always give a
Yeah.
paper that has all the information. That's what is on the box,
Yeah.
or in the box. So it's there, the warning's there. I gotta read mine.
This is that CERC article that I was telling you about, and there's some good key points. It's actually a 20-page article with 20 pages of citations, but when you get down to the summary,
There it is, DNA.
yeah, educate the workforce is one of the big.
Collect DNA and consent.
Yeah, so this is circulation saying, train clinicians to understand genetic screening tests for complex cardiovascular disease and stroke. Like I said, this is a heart journal, and refer to genetic clinics engage in a genetic counselor. And then they want to include genetics in graduate educational courses, educate researchers in genetics and computational. So basically they're saying education is a key component here. So it's not going away. CERC would not allow 40 pages of their newsletter to be dedicated just to genetics if it wasn't that important.
Didn't you say that the new docs graduating this?
They're
having
being
study genetics on their boards?
they're being taught as that's
It's on the boards. Yep.
Yeah, it's on the boards for cardiac and anesthesia right now.
Which means that they had to learn it in school. It'd be a dumb school not to put a semester on this, because that's all you need.
Maybe we could go back all the way to the beginning, Ed, and just for Craig and Collar's benefit. Let's say Craig's a physician, he's 50 years old, and you approach him and say, Craig, or Dr. Waldrop, are you doing any DNA testing? And Craig responds, no, I'm familiar with it, but that's not part of my training. That's something I'm really not interested in. Do you get that at all from?
Yeah.
Okay. And
I don't know what to do with it.
And what's your response?
Well,
You're a dumb shit.
You got a 2-minute window now, and the elevator's stuck. So what do you say?
well, he did.
And I know we heard it last night, and I thought we could replay it.
Well, let's hear what you say.
Well, I don't think I could articulate it as well.
But I'd like to hear your response.
Yeah, I think I'd muddy it up. I don't have it down.
So you gotta get a attorney down
You know what it is?
I'll help you. Just I want to hear you say
I
it.
need.
You buy now, you like.
We tell you later.
So you see this, pull out a lot of money, say, look, this is for you.
I think what he's looking for is this stockbroker analogy.
I know.
Yeah, that's kind of where.
And I want to hear you say
No,
it.
I don't think I have it down. I really don't. I
You're not going to get it down until you say it.
I heard it, and it hurt me.
Let me
to
see
hear
if I heard it right.
Okay.
Doctor, when you go and make your investments, which I'm sure you're involved in some investments because most doctors are,
Sure.
wouldn't it be nice to know the losers up front?
Yep.
Well, that's what we're doing here. We're weeding out the losers so you can control it better.
Yeah,
little bit.
Ed worded it a little.
I know,
bit.
but I'm just saying that
Yeah.
those are my words.
It's sort of like if you've got the Rosetta Stone to be able to, you've gone down this road before, and you've got this pattern where you're certain stocks, and Craig is also another.
Okay, so you and I will role play. You're the doctor, okay? You just told me I don't get it. I don't understand.
Well, not only do I not get it, but I really have my own training, and I think at this point I'd have to think. I'm more comfortable using the one pill fits all because it's
Right,
I've never
exactly.
been called on it.
Yeah, exactly, and that's the way everybody's been trained, but, you know, there's new technology out there, and it's a simple analogy, so if, you know, you invest money as well as I do, so if we had a investment planner that could use a tool to eliminate all our poor investments, would you want your financial planner to do that for you?
Yes.
Yeah, absolutely. Well, me too, and that's exactly what genetic testing will do for you as a physician. Before you even dispense medication to a patient, we will actually allow you to see the people that will never respond or be poor responders to that medication based off of their genetics. That's it.
The objection the doctor will still have is that I'm pretty set in my ways. I appreciate all that new young stuff the new internists are bringing out and science is bringing out, but until the American Medical Association has a, you know, stamp on it, I'm just going to stick with that.
Consensus statement.
What's that?
You're looking for a consensus statement.
Right. You get that?
Yeah, and right now there is no consensus statement out there. This whole technology, this industry as a whole is only 3 years old, okay? However, as you know in medicine, it takes time for a consensus statement to come out, but actually this month there in CERC there was a 20-page article dedicated to genetics and how important it is. And one of the 4 key components of the summary was to educate the workforce, and that's what I'm here to do. And you know, pass the knowledge that we have from our lab and how it can help you better treat your patients. It's already standard of care at Harvard, Scripps, Mayo Clinic, at University of Florida, Texas, or New Orleans Children's Hospital. If you go down to New Orleans with your child and they get sick and you take them to the hospital, they won't dispense any medication until they've been genetically tested.
Okay. Your 7 minutes is up. Get out of my office and we'll see you next Tuesday.
Here's your $200.
Don't forget the copay on the way out.
Exactly.
Well, I mean, even though they're not familiar with it and they don't, you know, they haven't done anything, don't know what to do with it, it's still, I mean, can't they still easily see that it takes the risk out for them and it covers them and it doesn't cost them?
There's a statement that 90% of the doctors know about, have heard about genetic testing, and they know it's important. But only 10% of the doctors know what to do with the information. So what our responsibility is to take that 10% and get it up to 80, 90%. And when I go through all this after today, there'll be a lot of things here that you can go to individual doctors, pain doctors, cardiac doctors, general practitioners, and give them specific patients that they can benefit the patient by using the test appropriately.
Yeah, yesterday, a guy, Bob Slosher, who's a well-known realtor here in town, and I paid a visit to his family doctor. Bob went in to have some blood work done, have a urine test. This is all happening while I'm in the room with him. And Bob, that was Bob's ploy to get me in front of the Dr. Bauer. And I asked the doctor, are you doing any DNA testing? He said, no, I've talked to Bob about this earlier, and I was aware that you might be coming, but you know, I really want to get involved, but it's got to be the right lab. And I said, well, let's talk about the lab. Okay, I know quite a bit about the lab. I haven't visited them, but we're planning on going in January. He said, I'd like to see a copy of the report. Well, I had the book with me. Opened it up, showed him there's a 60-page report, but it condenses it down to 2 pages. And they're color-coded, yellow, green, and red. And the green is everything's okay. It shows how the testing, how this particular patient would metabolize certain drugs. And we're going to get down to some of the basics of that, but it's basically how quickly your liver can process it and get it out of your body. Sometimes it's fast, sometimes it's slow. But anyway, that report had one red. He zoned it. He already knew the pathway. He knew what it was called, everything about it. He just wanted to know, you know, how it works. And now Bob called this morning, or sent me a text early this morning, that both doctors have signed up. They want the tutorials. That's the first step. You sign them up. And they want some swab kits. They've got 3,000 patients, 10% of their population is Medicare. So they've got 300 swabs and they'd like to get started on in January. And it was pretty much that simple. That was just having that form and showing that quickly what Ed just described is why you need to do this. Because if you don't, then you have a patient that has an issue and ends up in a wheelchair or the ER room, you have a potential lawsuit. This would absolutely protect the physician.
Okay. So, we're gonna go ahead and start here.
Start meeting. Share better. You are the only participant in this conference. The recording has started.
Okay, we're gonna start the how to sell the AI Biotech personalized panel, cardiac panel, and pain panel, and we're gonna go over some forms to fill out later on in this presentation.